Hello, my name is Dr. Rena Stewart. I am the new orthopedic trauma surgeon here at Quincy Medical Group and at Blessing Hospital, which is essentially the practice of fixing broken bones. I tell everyone I'm the new broken bone doctor. About 3/4 of my practice is what we would call hot trauma. Someone has been injured and I treat them virtually right away. They're coming from an ambulance, the helicopter, etc. The other 25% or so of my practice is patients who've had complications from their trauma. Someone who's had a broken bone in the past, it has not healed at all. It's healed in a bad position. I have a particular interest in complex elbows. Now, I do a lot of trauma around the elbow, but that has evolved into a practice for people who have lack of motion in their elbow, chronic pain around their elbow. I do elbow replacements, radial head replacements, which are a piece of the elbow. I also do orthopedic infections. Trauma is one of the reasons people develop infections, so in a lifetime as a traumatologist, there's a number of infections I've had to treat, and I've developed, again, an interest and lots of experience in that, so I do treat a lot of people who have bone infections as well. We're offering a sort of a new horizon at Blessing in terms of orthopedic trauma. People who had a serious injury, a pelvis fracture, a bad fracture near their knee, a complex elbow or upper extremity, were having to go somewhere else. They were being sent out in the ambulance or the helicopter. What we now offer is the ability to stay right here in Quincy at Blessing Hospital and receive that level of trauma care that you had to go somewhere else for. I think that's a huge plus. I've practiced all over Canada and the United States. I've been at 2 of the largest university hospitals in the country. Blessing is probably the finest hospital I've ever set foot in. My husband and I actually renovate historic homes. Part of our interest in coming to Quincy was the incredible number of historic homes that are here.